This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor. So you wanted to talk about the cervix, and this all came up because of a friend of yours who's needing to have a hysterectomy.
Right.
And she was wondering, she'd heard about people leaving the cervix or taking the cervix at the time of hysterectomy and wondered what the pros and cons were. So she talked to us last week.
Well, yeah. And she actually asked me this question because I'm her friend and I couldn't answer the question. I'm like, wait, I can't answer that question and we should do a consult with me on this.
Exactly. So here we are.
Here we are.
So usually a total hysterectomy, whether it's done vaginally, laparoscopically, or transabdominally, involves removing all of the uterus, which means the fundus of the uterus and the cervix. It does not include, by definition, it does not include taking the tubes and ovaries. So when people say they had a total hysterectomy, that's all they're referring to. It doesn't have anything to do with what's happening to the tubes and ovaries. And sometimes they're left, sometimes they're not. It really depends on the clinical implications. And in this case, the question was, what was best for her to remove the cervix or not, given the indications of the operation. In her case, she has fibroids of the uterus, benign, muscular, fibrous tumors, which are causing a lot of bleeding and some pain. And so that's what needs to be taken out in her circumstance. Right. There's nothing wrong with the cervix. She's, I think, around 48.
Yeah.
Yeah. And so there's the question also whether the ovary should be removed at the same time. What needs to be done in this case, now I think everybody would pretty much agree, is that the uterus needs to come out and the fallopian tubes need to come out. The questions are about the cervix or about the ovaries. And today we're going to talk about the pros and cons of leaving or removing the cervix. Up until about 20 years ago, the cervix was always taken out. But the cervix is at the keystone, at the focus, the fulcrum of the pelvic floor. So you don't really want to interfere with that if everything's working. And for a lot of people, if they've had a cesarean section or had no vaginal births, that pelvic floor is pristine, is great. And so you want to keep that as intact as possible. If the cervix is taken out, the fascia, the rest of the pelvic floor is sewn together. So there's not usually a problem with that. So it comes down to whether or not the cervix itself should come out, leaving aside the pelvic floor. And the points are that, in my experience, patients who have the cervix, who do not have the cervix removed, have less postoperative pain than if the cervix is removed. And that's because if you take the cervix out, there is an incision in the vagina. And that needs to heal. And I think that's the reason for people having more pain. There's not documented evidence of what I'm suggesting or what I think because of the pain, but in my experience, that's been the case. So pain is one issue. A second issue is that a supracervical hysterectomy, in other words, leaving the cervix behind, it's just another term for it, is a little safer of an operation than a total hysterectomy because the surgery is not getting as close to the ureters, and damage to the ureters is a well-known complication of hysterectomies,
ureters,
however they're done.
Bladder, is that what you're talking about?
The ureter itself, yeah. That's the tube that runs from the kidney down into the bladder.
Okay.
If you damage that, particularly if it's not realized that happens, you can get permanent kidney damage. You'll certainly get symptoms of pain. And so a lot of surgeons like myself, will do an examination after a hysterectomy to see that the ureter is working fine. And so we want to, if there is a problem, we want to recognize it right away. So there's a little more chance of damage to the ureter if you take the cervix out as well. The third thing, and more controversial than anything else, is sexual function of the cervix. For some women, they feel a cervical orgasm during intercourse, or actually during any stimulation and orgasm. And so the quality of their orgasm may change if you take the cervix out. That isn't the case for everybody that it happens to, and most people after a hysterectomy, sex will be better than before a hysterectomy because they've had some reason for the hysterectomy that may include pain, and that may have diminished the benefits of sexual activity. But the patient may notice a change in orgasm strength and character. The other thing is that the patient's partner, male partner, may be able to feel the cervix during intercourse, which is pleasurable and to both parties. And so that will definitely be gone. Whether it's a big enough issue that the sexual activity, the sexual pleasure is diminished significantly is hard to say. And as I say, there's no studies done that in the most sophisticated manner of research to determine whether it's better to leave the cervix or not. But because of less pain, less chance of injury to the ureters, and the presence of the cervix during intercourse being beneficial, I think it's a good idea to leave the cervix unless there's a problem with the cervix.
Right. Unless there's some cancer or even like precancer, right? Precancerous
Yes, exactly.
stuff that's happened in the past.
Yeah.
Yeah, those types of things.
Exactly.
Those red flags. But if
Yes.
no red flags like that, best to keep it.
Right.
Perfect. Thank you.
You're welcome.
Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.